Good afternoon and a very warm welcome to all our viewers to today's special Health Day session on the occasion of COPD Awareness Month. COPD Awareness Month, observed each November, aims to increase the understanding and awareness of chronic obstructive pulmonary disease. COPD is a progressive lung function that affects millions worldwide, causing breathing difficulties and impacting the quality of life. This month encourages education, early detection, and advocacy to support those living with the disease and reduce its prevalence through prevention and treatment strategies. It's time to shed light on the importance of lung health and promote resources for better management and support. Today's session is brought to you by our collaboration with Sipher, which is the Strategic Institute for Public Health Education and Research. Inaugurating the session and welcoming our special guest for today is Dr. Rakesh Gupta, President and Director of Sipher, Vice Chair of the Tobacco Control Section at the International Union Against Tuberculosis and Lung Disease, and member of the Ethical Committee, Chandigarh University. Dr. Gupta has been a recipient of the WHO World No Tobacco Day Award and is also a certified tobacco cessation specialist. He's the former Deputy Director, NCD's Director, Health Services, and Director of Chemical Examiner Lab, Government of Punjab, Chandigarh. It's a pleasure to have you with us today, sir. Over to you. You may please introduce our speaker, Dr. Sushil Gupta, Additional Director, Pulmonology and Critical Care, Fortis Hospitals, Ludhiana.
Good afternoon, all the viewers. So this is COPD Awareness Month, November 24. So we will be talking about the COPD Day. So this World COPD Day activities are organized in each country by healthcare professionals, educators, and members of the public who want to help make an impact locally and worldwide. The 2024 theme for the World COPD Day is to know your lung function. This year's theme aims to highlight the importance of measuring lung function, also known as spirometry. Although spirometry is an integral tool for diagnosing COPD, COPD's full form is chronic obstructive pulmonary disease. It can also be used to measure lung health throughout the life. We now know that there are many other factors besides tobacco smoke, which is an important causative factor that can contribute to COPD. Throughout our life, we are vulnerable to issues such as air pollution and respiratory infections that can impede lung growth and increase our risk for developing chronic lung diseases later in life. Unfortunately, such lung function can be lost before we develop the symptoms. Lung function is not only a predictor of lung health, but our overall health. Measuring lung function throughout life can provide opportunities for early diagnosis and proper treatment of multiple lung diseases, including COPD. And as I told you, that as many as half of the people, they are unaware that they have COPD, and the symptoms are wheezing, blue lips or fingernails, frequent colds, swollen feet, ankles or legs, having to clear our throat a lot, and there's just tightness also. And there's some breathing exercises for people with COPD. So we'll be listening to Dr. Sushil Gupta. So Dr. Sushil Gupta, you're welcome to this webinar. Additional Director, Pulmonology and Critical Care, Fortis Hospital, Ludhiana. Dr. Sushil Gupta is an MBBS graduate from DMC and Hospital, Ludhiana, and postgraduate in chest medicine from Sir Ganga Ram Hospital, New Delhi. He did his training in critical care medicine from Sir Ganga Ram Hospital. During the post-graduation, he was awarded Young Scientist Award. So over to Dr. Sushil Gupta. So Dr. Sushil Gupta has stopped sharing and you can share your presentation.
Thank you, Dr. Akir, for wonderful introduction. As you have already highlighted the COPD and its symptoms, and especially when we are observing the World COPD Awareness Month in this November. Every year we observe COPD Awareness Month, and we also observe COPD Day every year, so that we can increase the awareness and share different views on this COPD among general public, so that COPD can be prevented or it could be addressed properly. As we all know that there are a lot many patients of COPD worldwide, especially in lower middle income group countries, where there is a lot of unawareness, which leads to a lot of morbidity and mortality. So I also thank everybody who are giving their precious time to hear the different opinions or the relation of tobacco with COPD with us. So today we are going to talk the relation of tobacco and COPD. Though the my presentation will be of in two parts. First, mainly the tobacco and its effects, and second is the COPD. So then we will correlate little bit between the tobacco and this other lung disease also. So just we all know that COPD is very rampant and it's the chronic disease and it is one of the preventable disease, preventable by that we can increase the awareness so that people don't smoke, don't start smoking, and if somebody is smoking, he or she can stop smoking before it causes damage to the lungs. So there are various aspects of tobacco because among most commonly the cigarette smoke, which affects the lungs. So it contains almost 7,000 chemicals, which are harmful for lungs one way or the other way. And the effect of tobacco varies from person to person depending on the age, weight, and how person smokes, and how many it smokes at what age person starts smoking. Earlier the person starts smoking, the more effect it will be on the lungs. And different methods of tobacco consumption, and especially the smoking, like there are different ways of smoking like cigarette, bidi, hookah, or cigar. And among them all, the bidi is the most dangerous. Though many people consider, especially the labor class or the lower income group people, they think that bidi is not that harmful as compared to the cigarettes. But on the other hand, the bidi is much more uh, harmful than cigarette for two reasons. One is the leaf in which tobacco is wrapped. The burning of leaf itself, that tender leaf itself produces the different chemicals which are more carcinogenic along with burning of the tobacco. Secondly, there is no filter in the bidi as compared to the cigarettes. So I don't advocate that cigarette is better, but both are harmful. But among them, the worst is the bidi, followed by this cigar, and then cigarettes. Another important impact of the tobacco is depending on the use, how much it is used, and it's whether regular use or the occasional use. Like any other medicine, it has also different side effects, various side effects, and there is no set limit of tobacco use or the smoking. Because many people in practice, they ask how much it's safe to smoke and how much tobacco consumption is safe, but there is no safe limit. And even small quantity of smoking or tobacco chewing is harmful for the health. But the question comes, why person smokes? It has short-term effects, like it causes initial stimulation of the brain that makes people happy, and ultimately long-term, it reduces the brain activity. It increases the alertness and concentration. That's why many people, students, they start smoking in the young age. Or many people who have job, they have to pay more concentration or their needs to be alert. They are start smoking, feeling of euphoria and feeling of relaxation. Like many people, those who work in lot of stress, they start smoking, but it gives them feeling of relaxation. And various short-term side effects of the smoking is the first and foremost is it increases heart rate and blood pressure. It decreases appetite. It causes bad breath, and to some persons, it causes nausea and abdominal cramps, headaches, and these are the two common short-term effects of smoking. But the long-term effects that of the tobacco is that it increases risk of stroke. It causes different types, 12 different types of cancer. The most common is the lungs, throat, lip, tongue, mouth, pharyngeal or laryngeal carcinoma. Apart from this, it also lead to the stomach and the bladder cancer. It causes the high blood pressure and heart attacks. It increases the risk of osteoporosis, leading to fractures and back pains. And it also leads to damage of sperms and causes the impotence. And it's the special effects, especially during the pregnancy. It affects the growth of babies, and it also causes the malformation, uh, low birth weight babies, and early babies. And among lungs, it causes most commonly the cough and shortness of breath. among different diseases, it causes most common is the COPD, which is chronic obstructive pulmonary disease, lung cancer, triggering of asthma attacks, and it also increases risk of various infections, including tuberculosis. And it is linked because it causes the structural damage to the lungs, impairing the local immunity of the lungs. So lungs are more prone for different infections or tuberculosis because in India, tuberculosis is very rampant. So while we are stressing on the smoking, there are a lot many factors which are affecting the lungs in India or during the lifetime. But why smoking we are stressing? Because there is increased prevalence of smoking and it causes many more deleterious health effects apart from lungs and various chronic disorders which can be prevented by smoking in the COPD and lung cancer. And it has special mention during the pregnancy. As I have already mentioned, it causes low birth weight babies, premature deliveries, and various developmental problems in the newborns. If we talk of the cigarette smoking, in US, it causes almost 480,000 deaths per year. And it accounts for 70% of COPD cases due to smoking in high income group countries, whereas it is 30 to 40% in middle income group or low income group, because many more patients are because of the biomass chula smoke or the burning of various wood or coal and all various other factors, the industrial pollution, various other factors which also contributes to the COPD cases. But the is emphasis on that there is increased risk of COPD and there is increased number of cases of COPD is because of cigarette smoking even in low and high income group, low and middle income group countries. And cigarette smoking is also a major cause of lung cancer, though there are many more reasons for lung cancer, but smoking is on the top of the list. And it is be also found that person who smokes, he is more 20 times more risk of getting lung cancer as compared to the person who is not smoking. And many people think that e-cigarettes or vaping is not harmful for the lungs, but it is not like that because the different chemicals are produced during the e-cigarettes or vaping, which are also harmful to the lungs and overall health. COPD, chronic obstructive pulmonary disease, which is poorly reversible disease, and it is a group of disorder where we can have airflow obstruction causing breathing difficulties. And if we leave aside the COVID, then it is the third leading of death worldwide after uh, heart diseases and stroke. Then 80% of COPD deaths are related to smoking, and almost 3 million lives are lost every year. And 38% of COPD cases are even still smoking, and they have doesn't leave the smoking even after the diagnosis of COPD. And one more important fact is that secondhand smoke, that we call it as a passive smoking, it causes almost 25% of the COPD cases. So we should advise people not to smoke and also not to sit or stand beside the person who is smoking. So COPD consists of mainly two varieties. It's the chronic bronchitis, in which there is long-term inflammation of the airways, and person presents mainly with cough, expectoration, and breathlessness. And second is the emphysema, which affects the alveolar sacs or the alveoli in the lungs. It causes cough, breathlessness, and extreme tiredness. So, but most of the patients, they are not having either chronic bronchitis or emphysema. They have both the components of chronic bronchitis or emphysema. So, in the latest world, by and large, both terms have been getting obsoleted, and one only common term, COPD, is being more frequently used rather than chronic bronchitis or emphysema. So, if we go with the pathophysiology of COPD, it's the immune response to various toxins, particularly the smoking. All smokers have inflammation, but they have been enhanced response in smokers, especially persons who are suffering from COPD. There is increased mucus or the sputum production and ciliary dysfunction, which is the main component of the chronic bronchitis, and disruption of small alveoli where there is oxygen exchange program occur between the blood and the air, where we call it as emphysema. Then there is disruption of normal repair and defense mechanism, which affects small airway and airways, and we call it as a bronchitis. So whenever there is airways are involved, so there is increased resistance to airflow of the during the breathing, and whenever the lungs are alveoli are involved, then there is increased compliance and loss of plastic required of the lungs. And both of these, predominantly the obstruction of the airway causes air trapping. We call it as hyperinflammation. Physiologically, there is a reduction in capacity of the lungs, resulting in breathlessness and limited exercise capacity because patient gets breathlessness during the activities. And progressive is the progressive disease. Initially, person gets breathless by on strenuous exercise, but why the disease progress? Even person gets breathlessness even on rest or doing small activities like changing his or her clothes. Then there is also in advanced cases, there is a problem with the gas exchange. So person needs oxygen at home or may need ventilation, or we call it as BiPAP or NIVs, even at home during the sleep or even during the activities. So various comorbidities associated with COPD are high risk of lung cancer, high risk of cardiovascular events, type 2 diabetes mellitus, cerebrovascular accidents, or strokes. There is increased risk of osteoporosis, and it also leads to poor quality of life. So the COPD is not only related with smoking, as we have already discussed. It could be due to genetics. It could be due to environment. It could be due to infections, or it could be due to advanced asthma. For many COPD patients, we don't know any result. But still, smoking is the most prevalent cause of the COPD. So whenever patient is having progressive dyspnea or patient is associated with whistling sounds or chronic recurrent chest infections, and then we think of COPD, and then we also look at the various risk factors of the COPD, like tobacco smoke, occupational smoke, or smoke from home cooking or heating fuels, various industrial pollution, etc. Then there are many more causes of cough apart from COPD, which could be both within the chest or out of the chest, like allergies or refluxes or various medication. Not going much into the detail. And the COPD mainly diagnosed after the clinical suspicion is based on the spirometry. And these are the various graphs and various values which tells us about the diagnosis of COPD and its severity. And the theme of this COPD is to know your lung functions. And this is how, with the help of spirometry, we know our lung functions. And it is done for diagnosis of asthma or COPD or various other lung diseases. It also helps us to monitor the various health of the lungs and to know the response of the treatment and various other uh, before occupational joining or various other types of the life, we need the spirometry in patients with lung disease. So based on the criteria that it has been defined as mild, moderate, severe, or very severe, this is based on the values on the spirometry. So based on the clinical fronts, we have two scales, MRC dyspnea scale and CAC assessment scale. Based on this, we assess the quality of life or level of COPD in patient with COPD. So among medical management, after spirometry, we also grade patients on the ABE assessment tool. This is basically because of the, we also consider risk of hospitalization as well as the exacerbation in the persons. So role of CT in COPD is very limited. It is basically used to know the various other causes of lung diseases or before any surgery or to screen the lung cancer because smoking or various other factors, they are common both in lung cancer as well as COPD. So we also need to screen the patient of COPD for lung cancer. So goal of treatment for COPD is first is to reduce the symptoms and to improve the exercise tolerance, improve the overall health status, and to reduce the risk of disease progression, hospitalization, or death related to the COPD. Various pharmacological treatments, which mainly includes the inhalers and steroids or various other bronchodilators. Apart from this, it's the antitussis, vasodilators or opium, and various pulmonary rehabilitation programs, smoking cessation. These are all different modalities to treat as a total a patient of COPD. So, among treatment of COPD, we need to identify and reduce the risk factor exposure. Like smoking cessation should be actively pursued in all patients where smoking is not the risk factor, but other like pollution at home or occupational pollution. We need to intervene so that person can be prevented from exposure to such pollution. And clinician should also advise patient to avoid continuous exposure to potential irritants wherever possible. Among different treatment, vaccination also carries importance in COPD patients, like mainly the influenza or the pneumococcal vaccine. There are other vaccines like DTaP for pertussis, then herpes vaccine for prevention of other infections in patients with COPD. So, apart from this, we need to focus only the smoking cessation because there are many factors, marketing policies of the companies and other things which promote smoking, and especially the young adolescent age group people. They are more getting attracted for various reasons or the peer pressure. They are more inclined towards the addiction, smoking, or various other factors. So we should increase the awareness so that person gets away from the smoking. Once persons do not start smoking, or even if everybody has started smoking, we should not say anything bad about them. Rather, we should cooperate with them so that we should encourage them and we should help as a clinician, as a family, or as a society that we should cooperate and we should help them for stopping the smoking so that we can prevent them from getting various health hazards, varying diseases during the lifetime, particularly the lungs, and with more commonly is the COPD. And later on, we can also prevent them from the lung cancer or various other risks of the various deadly diseases. So, with this, I stop my presentation here, and I would like to thank you all. And I all request that we should spread more and more awareness so that we can help our society to become more healthy and better. Thank you.
So thank you, Dr. Sushil. It was a very informative talk, and I'm sure that it will help the general physicians and the public health experts, especially the tobacco control activists. And you told about the correlation of tobacco use and COPD. Is there any correlation between the chewable tobacco and COPD?
No, it's not much correlation, but it's mainly due to the upper airway which gets involved in the chewable.
So inflammation is there even with the chewable tobacco.
Even if that, but it's not much impacted. The COPD is mainly due to the smoke which gets inhaled.
Okay. So you told us about other harms of the tobacco use and why COPD awareness is important. So that is really important that you must make people aware about the COPD. COPD, you told about the definition, the symptoms, the pathophysiology, and you told that first-hand smoking can lead to 38% of COPD cases, and the second-hand smoking can lead to 25% of COPD cases, and that is really very knowledgeable for us. And you also talked about the comorbidities, the lung cancer, diabetes, stroke, osteoporosis, then poor quality of life, pulmonary hypertension is also associated. You also told about the causes, the symptoms, the signs, and why spirometry of the lung function test is important to diagnose COPD, and why we must know the lung functions. So that is an important point in the theme itself. And you also told about the management of the how we can manage COPD cases. So thanks a lot. And you also told us about the vaccination part. We never knew that there is some vaccination also for COPD. So can you elaborate on the vaccination?
Mainly, if we talk of the lungs, we call mainly the vaccine is the influenza vaccine, which prevents us from the viral infections. It is given annually, or even sometimes we need to give it twice a year.
Okay.
So it prevents different viruses, as including the H1N1 of the swine flu. And the second most common of helpful is the pneumococcal vaccine. It's again two types of the vaccine. It is one is 13 valent and the another is 23 valent. So ideally, both are should be given 1 year apart. And third vaccine is which we are coming latest is the herpes vaccine, or Glaxo is advertising it as a Shingrix, especially in the older age group. And third is the DTaP, diphtheria, pertussis, and tetanus vaccine. And even if person is getting during the childhood, one can again repeat it to prevent it from the pertussis and the diphtheria. So these are the mainly vaccines related to lumps, which can be given during the adult or the elderly age. And we
Okay, thanks a lot, Dr. Sushil. So I may tell you that Sipher is the public health organization, strategic institute for public health education research. And DocPlexus, they have about 3.8 lakh as subscribers, mainly doctors. Doctors and even the dental surgeons are the subscribers to DocPlexus. So it will be disseminated very widely.
Thank you so much, Dr. Sushil Gupta, for that very insightful and detailed presentation on the relation between tobacco and COPD. We would also like to extend our sincere gratitude to the entire team of Sipher and Dr. Rakesh Gupta for helping us put together today's program. It's always a pleasure working alongside you, Dr. Gupta. To all our audience members, thank you so much for your active participation in today's session. If you have any questions, please feel free to drop them in the chat box below, and we'll get back to you with the responses after consulting our expert, Dr. Sushil Gupta. Thank you so much once again for joining us today. Have a good day.